All right. Welcome to episode 17 of the Dreamers podcast. Today we're joined by a medical student whose journey demonstrates that medicine doesn't have to fit the traditional mold. She's been educating students online, sharing her experiences through social media, and pursuing the unique path of becoming a physician involved in combat sports. As always, I'm your host, Mani Rahman.
And I'm your co-host, Aswan Musa. The guest that we have today is Misha Dilma. Misha is a medical student at Kansas City University College of Osteopathic Medicine, going into her fourth year. Congratulations. She has built an online community by sharing the realities of medical school, productivity, wellness, and personal growth. Misha, welcome to the Dreamers Podcast.
Thank you guys so much for having me. I'm so excited.
Wonderful. We'll go straight into the first set of questions for you. I wanted to talk about your path, which I don't see a lot of people take.
Mhm.
Many students in medicine, they enter medicine with traditional career goals, but your interest in combat sports medicine is incredibly unique. When did you first realize that this was something you wanted to pursue?
Yeah, this was actually so when I first got into medical school, I thought I wanted to be an ENT. I thought I wanted to go into the surgery route, just because that's what I was kind of exposed to. It wasn't until I got into my third year of medical school. I started going through med school, all my rotations, and I realized I didn't like anything. And I was so afraid. I was like, oh my gosh, everything that I had thought was supposed to be medicine, this is not my passion. And I didn't want to become one of those physicians who like post a YouTube video like 10 years later and it's like, I quit medicine because I was burned out.
Yeah.
Because I did. I truly love medicine and I still love medicine to this day. And that's really all I saw myself doing, but not in the way that it was traditionally presented to me. And so I remember one day I was like, okay, you know what? I'm just gonna go find a boxing gym because I need to hit something. I need to hit
Let the
something.
pressure out.
Exactly. I was like, I need to get all my aggression out and just maybe then my mind will reset. So I went to this boxing gym, Osberg Boxing Academy, shout out in Joplin, Missouri. And I started hitting the bag, started working with the team, and I realized I love boxing. I love boxing so much. This is a great outlet. And then I looked into it further and I was like, wait, don't fighters need doctors too? So it
They
was
do.
just
Yeah.
that one moment specifically that I was like, I think that I could get into ringside medicine, into combat sports medicine. And then actually the following month, I did a rotation in sports medicine and I loved it. And it was like a sigh of relief because I was like, oh my God, okay, there is something for me. There's something that I can see myself doing for years to come. So sports medicine, ringside medicine, I just fell in love with it immediately there.
Were you open to any other sports, or did you know, like, okay, combat sports was something that you wanted to go into for sure?
Oh, I was open to all sports. So I actually played volleyball throughout all of college. So I was a volleyball player. I was always athletic. I love to lift weights and I love to work out. I just never thought that I could do that in medicine because I was in when I first started medical school, I was very one track mindset, like surgery and that's it,
Mm.
ENT and that's it. And then when I realized that there were so many other options, I was like, oh, the world is my oyster, baby. Like I can do whatever I want. So yeah, no, I love basketball. I would love to work for like a basketball team. Hockey, everything, volleyball, everything. But
I love that
yeah.
because a lot of pre-med students, they have something in mind. Okay, that's what they want to do. But I like telling people, I mean, I have something in mind as well that I'm very passionate about, maybe that I want to get into. But I know I'm going in with an open mind when the clinical starts for med school and everything. I know it could change, so it's okay. So I love what you did. You had a straight path, but then you explored other options and you fell in love with what you really like, which was sports, and you can make it happen because some, it's just like a stigma where people say if you're doing medicine, you can't do anything else. You cannot have a life outside of medicine, but you made sure that wasn't the case. You did
Yeah.
exactly what you like. So I really respect that. And
Thank you.
my next question for anybody who doesn't know that MMA physicians do exist, can you tell us more about what they do exactly and what type of role you see yourself being in?
Yeah, absolutely. So physicians who work ringside medicine, a lot of the times, a misconception that people have is that they think that they only are ringside medicine physicians. That's normally not the case. the majority of doctors, I would say 99% of doctors, they all do something on the side. Now, it doesn't matter what type of doctor. I've worked with dermatologists, I've seen family medicine doctors, I've seen emergency doctors. A lot of them just have a passion for ringside medicine, so that's something that they do. They cover fights on the weekends. So most of them have a regular 9 to 5 job. They have a career doing whatever medicine that they practice, and then they do ringside medicine on the side. What it typically looks like for the fights that I've worked. So I've worked pro fights and amateur fights. Normally, you are there also for the weigh-ins. I have never yet been at the weigh-ins. But the physician will be at the weigh-in. We also do pre-fight physicals. So before the actual fighter goes on, we are there checking, making sure that they're okay. They haven't had any recent head traumas, doing a quick physical, MSK exam, all that good stuff. And then you actually get to the ring, which my favorite part. You sit ringside, you have the fighters go up there, watch the fight, make sure that there are no obvious injuries. Obviously, combat sports is a combat sport. So head trauma, lacerations, these are things that happen in real time and you have to be able to react really quickly. Now, again, I'm still a medical student, so I don't do this by myself. I'm with my physician who is trained and certified in this. But a lot of common things that I've seen, and great thing, a lot of these ringside medicine docs that take students on, they love you to love the sport. So I got to be super hands-on. I would do a full neuro exam. So quick side story, I was at this fight. Guy got knocked out. I mean, kicked in the head, like 2 head kicks. I was like, oh gosh.
Oh, wow.
So we ran into the ring. It was like adrenaline pumping, all ready to go. Had to do a quick neuro assessment, make sure he didn't have any head trauma. I mean, obviously he had head trauma, but no intracranial bleeding or anything that would require the EMTs to come in. Do a quick neuro assessment, get him up and out. It was insane. It's very fast paced. And you have to rule out anything that could potentially be deadly there. But I absolutely loved it. That's kind of what you'll see during an actual fight. And that's pretty much the role of the MMA physician. Now, again, a lot of these doctors are, at least the ones that I've worked with, are sports medicine doctors. So they do work with athletes alongside for things that maybe won't be as serious, like shoulder pain, shoulder injury, the tore ligament, et cetera, et cetera. But that's kind of what you would see on fight night, which is my favorite night.
I love that. And you have the best seats for the fight night too.
Yeah.
You have the best seats. Yeah, you are ringside, baby.
I love that. And has there ever been a moment when people questioned your vision or told you that your goals were too unconventional? And if so, how did you stay committed to your path?
Yeah, I have to this day, I have people who want to say that my path is not realistic. And it might not be realistic for them, for them. So, but for me, this is what I love to do. I don't see myself doing anything else. And that's the thing. When you have a vision, you really want to execute that vision because nobody can do it with your energy, no matter what it is. You don't have to be interested in ringside medicine, combat medicine. You can have a dream to be anything or whoever you want to be. You just have to execute that vision. And that's kind of the mentality that I always have, is that, yeah, it might not be possible for them, for the people who are telling us that it's unconventional. But for me, there's no other option. There's no plan B. Like, this is it. So you gotta keep going. And it's hard. It's hard, especially like you said, there's really nobody out there talking about ringside medicine or being a medical student showing the path. So I really do feel like, especially in this field, I'm the only one.
Yeah, it's very unique.
Yeah. It's kind of like me setting the foundation, which is scary because I don't know if I'm doing it right. Because what is right,
But you live and learn. Yeah, you learn. Even if there is something that you don't do right, you'll eventually learn it. All it takes is just practice. And I love what you said about maybe it's unconventional for them, but it's the right thing for you, because I read this thing online, which I could relate to. It's God gave you this dream because he knows you are capable of doing it, not anybody else. So you're on the right path, and I really respect what you're doing, putting a framework out there for other future ringside doctors. So thank you for doing that.
Of course.
We can move on to the next set of questions.
All right, so I guess I want to talk about the person behind the content, because I have looked into your content, a lot of variety, right? You're talking about your kind of med school life, also showing the ringside and also your workouts, your boxing, like, kind of
Mhm.
learning how to fight is really a good thing. Is you share a lot of that journey online. What originally motivated you to start creating content and opening up your experiences to others?
Oh, my favorite question because I always wanted to start content. I always wanted to start creating. I always had a need for a creative outlet, but I didn't know where I should place that creativity. I actually started Instagram 3 times. I started it, deleted it because I was so afraid of what other people would think. It's that you being putting yourself in the public eye is
Mm.
not for the weak. It's definitely not
Yeah.
for the weak. I remember like I got my first hate comment and it tore me up inside. And so I deleted my entire Instagram and started it again and deleted it and started it again. And then I realized like I want to do this. I have something that I can share to others. I can help others and I can create that creative outlet for myself that I've been so desperately desiring. So I actually started my Instagram that we see now today, right before I got into medical school. And originally, my very first piece of content was talking about how to get into medical school because I didn't know at that time I wasn't into combat sports at all. I didn't really know who I was. I was still growing and developing as a person. So I just said, hey, let me just put it out there on how to get into medical school because I got in, so I can tell people how. And that's kind of where I started, and it kind of flourished from there throughout all of medical school. I was able to stay consistent with it. I realized it was something I loved. The hate came my way, but I was able to handle it at this point in time, growing more confident by the day. And it wasn't, I started really my ringside and combat medicine content in my third year of medical school when that's what I realized I wanted to do. So yeah, it's been quite a journey.
And I feel like you kind of talked about this earlier too, is that other people will say or hate on something that you do, but it really matters what you think about it. And in the day, it's you versus you. It's what you want to do. And if you stick with it, you'll succeed no matter what. And I think you're a perfect example of that. And also highlighting your journey. I actually like the fact you didn't start with like ringside medicine. You weren't going for that. You kind of just started with your content. It kind of grew, kind of like your personal diary. So I
Mhm.
think that's a really good way to look at it, as well as other people that are motivated to start, just start, right? Don't
Yeah,
care about what other people think.
exactly.
Yeah,
Like, you don't even know where you're gonna end up. Never in a
exactly.
million years did I think that in my first year of medical school, I would be into MMA. Like, are you kidding me? Like, you think I would be into the UFC and boxing? I would never think that. I was just a young buck, just living
Uh,
my life, not knowing what I wanted to do, who I was becoming, what I wanted to be. So my advice to everybody out there is just do what you think you want to do and just watch what it flourishes into because 9 times out of 10 it will become something that you could have never imagined in a million years, and you're going to be so happy that you took that first step that most people don't take.
mhm. And also kind of talking about the highlights and also the challenges you face during social media or even in medicine in general. You
Mhm.
highlight both in your social media videos and stuff that I've seen.
Mhm.
How important is that authenticity as a creator?
Oh my God, it's so important. You know why? It's really because of your audience. So
Mhm.
your audience, whether you believe me or not, I'm telling you, your audience can tell how authentic you are. They can tell if you are actually being you or if you're trying to be someone you think that they want to see. And I will be completely honest, there were a lot of times in my content creation journey that I would compare myself to other creators and just think that I wasn't doing as well as they were. They were the aesthetic that I aspired to be and wanted to be, even though if that wasn't me, I thought that's what I wanted. And so I would try and portray that in some of my content, and my content would flop. And I'd be like, why? Like, why? This is what people want to see, right? No. People want to see authenticity. They want to see the real ins and outs of you because you are a unique person. They don't want to see the ins and outs of what you think person A over there is going to be, right? They want to see you. And it wasn't until I really embraced that and just started, I didn't care about perfection anymore. I was like, I'm just going to film this raw content of me studying, of me fighting, of me training, of me in the hospital, post it and let people know this is what it is and this is who I am. And then once I started to do that and I started to embrace myself there and no longer looked at other creators for as comparison, but rather as inspiration,
Mhm.
that's when everything really started working in my favor.
I
I actually
love
love
that.
that you said comparison, not comparison, but inspiration, because
Mhm.
that's what most people do is compare yourself with
Mhm.
others, which is not a good thing at all. You should not be comparing yourself.
No.
Everyone's journey is different. In fact, you should take inspiration. I actually love that. We might have to quote you
Especially,
on that, I swear.
especially
Go
medicine.
ahead, go ahead.
I
And
say
then,
especially medicine because medicine
yeah.
teaches you like how it's your journey. Don't try to like compete with anybody else. Some people take one gap year, two gap years,
Mhm.
or some people just go straight from college to medical school. So it's completely your own journey. Make it your own. Don't try to follow anybody else's footsteps,
Exactly.
basically.
Exactly. That's it. You hit it on the head. That's what it is.
Yeah. And then I guess talking about martial arts or just any combat sports in general, um, when you do record, is there certain, I guess, HIPAA like violations you have to worry about? Because I know that's a lot of things for content creators is to worry about how you can film your patients, stuff like that.
Yeah. So if it's in the hospital setting, yes. There's nothing that I will never film anything of any of my patients in any type of hospital setting or clinic setting, anything like that. That is something that you have to be very cautious of. So when I was in the sports med clinic, working all day every day, I saw a lot of athletes. I saw martial artists, but I will never ever compromise their safety
Hmm.
or compromise their confidentiality. So their cameras off.
Cameras off.
That's another thing about being a creator and being a physician or future physician. You
Hmm.
have to really tread that line carefully because realistically, people would love to see a in-person interaction, especially with an athlete, right? On my content. But that is something that I will never, ever, ever post. Like,
Yeah,
sorry.
and like the reason I bring that up is because a lot of people are trying to start social media, like people in medicine, and I think it's very important that there is a line you do not cross when it
Yes.
comes
Yeah.
to that. Yeah.
And I know some content creators who have crossed that line. And obviously, that's something that's very, very serious. And we
Hmm.
don't play around with that. However, when it comes to fight night,
And fight night.
the great thing about fight night, I mean, I don't record any of the pre-fight physicals or anything like
Mm.
that, but when we are actually on the ring, you may see in a lot of my content, I have my phone on the side and I'm allowed to record there. So that is pretty much as far as my quote unquote patients go, that is the only content that you will ever see with my patients because it's a
It's
fight.
ringside. SFI is public
Yeah.
event. Yeah,
It's a
Exactly.
it's way
public event.
different than
It's
a
being
hospital
recorded
setting.
anyways, I'm pretty
Yeah,
sure.
Exactly.
yeah.
Exactly. But any hospital clinic setting, if you are my patient in any form, even at the pre-fight physicals, that's a no-go. Like I will not have anything recorded there. And this is just my inspiration for anybody who wants to become a creator. If you are a medical student or if you are in the field of healthcare, you got to be really, really careful with this because at the end of the day, yes, I love my content. I love being able to inspire others, but I'm always going to be a physician. Right now, I'm a med student, but a physician first. So the privacy of my patients, most important thing.
More important thing. I love that answer. And then we'll go to the third segment.
Sounds great. Now I want to talk about your osteopathic perspective. As a student pursuing a Doctor of Osteopathic Medicine degree, how has osteopathic training influenced the way you think about patient care, especially in sports medicine?
Yeah. Oh my gosh. I love it. I think that it was the best decision I could have made. I was a little bit afraid at first because I didn't really understand
Good question.
the philosophy of osteopathic medicine. I really didn't. And I'm so glad that I made the jump because, again, remember, I wanted to be an ENT first. So I didn't think that it was going to be applicable to me at all. I didn't think osteopathic medicine was going to be anything that I could really do. But going into sports medicine, I realized how important it is to be hands on with your patient. And I think when you're talking about osteopathic philosophy, and ADO school, they really, really emphasize that in our learning. Now, I don't know how much allopathic emphasizes that, but I can say for osteopathic, very hands on. And I've realized that anytime I take my training to the patients that I see as a third year, they come out so satisfied. I've had patients thank me and just be so grateful for the time that I spent, a medical student. Like I'm a medical student, I'm not even a doctor yet, you know? So it's been absolutely incredible. I love it. I'm going to take it with me into my career. I think especially OMM in and of itself, becoming a sports medicine physician and a combat physician, that is going to be something that is key in any type of acute injury or if they have like some type of chronic shoulder pain. Like I've already been able to do so much and help so much as a medical student. I'm kind of excited to see where it goes when I'm actually board certified.
I love that because yeah, a lot of people complain about, DO physicians that they're never going to use their OMM, and because most of the fields it kind of makes sense, but something like sports medicine where you are interacting with your patients and you are trying to, physical checkups and all, make sure they're okay to keep going, to keep playing or fighting. So it is very important. I think you would be a better physician as a DO than an MD, especially in a field like this. So
Yeah.
I'm happy that you found your right path and you're taking that. That's amazing. But as you may know, there are still some misconceptions surrounding DO physicians. What do you wish more students understood about osteopathic medicine and the opportunities available to DO graduates?
Yeah, yeah. I think the stigma, actually they taught us this in our first year of medical school. The stigma that has came with being a DO physician, thankfully, is becoming less and less and less because
I see.
you
Yeah,
see more representation
correct.
in any field of medicine. Now, what I want to make clear to everybody out there is that your degree is not for show. It doesn't matter if you're an MD, it doesn't matter if you're a DO, it doesn't matter if you're a nurse practitioner, a PA, whatever field of medicine that you pick, that should be specifically and only for you, right? I think a lot of the times out here we see people who are pursuing a degree because of what they think that those two letters behind their name will bring them.
Yep.
No.
Mhm.
That's so
It's
true.
exactly. It's not about that. It's about, do you want to be a doctor? Do you want to be a doctor? Because whether you're an MD, whether you're a DO, it's the same thing, okay? Us DOs, we have a little bit of extra training in something called OMM, but other than that, same exact thing. I took step
Exactly.
one and step two. I also took level
Same.
one and level two.
Yep.
Yeah. So
Same
it's
exact exams that MD students take, so there is no difference. And we actually had another podcast with a gastroenterologist who was a DO physician, and he was telling us the same thing. When you are seeing a patient, no patient would ever ask you, "All right, wait, are you a DO? Are you MD?" They
yeah.
they
Yeah,
see
they
you as a
never ask.
physician.
Yeah.
They see you as a doctor. You have been trained the right way, exactly the same way that any MD student would be. So your job is to be a better physician for them and make sure they feel safe and well treated, and
Agreed.
that's all that really matters. So
And I feel like DO doctors look for the holistic approach, right? Like rather than
yes,
just prescribing medicine, you're trying to go find all the options and solutions
yeah,
before
because
going that medical route.
if anything, I think it's better because the
Yeah.
whole philosophy of osteopathic medicine is like it emphasizes treating the whole person, or whole person approach. Yeah, basically
Mhm.
holistic approach, like Manib said, and that's why I'm applying to a lot of DO schools. I'm applying to psycho as well, and I'm
Go.
going for the DO. If I get a DO acceptance, I'm going straight into it. I love the DO approach, and I the field that I'm interested in is emergency medicine. So a lot of DO physicians are actually they have high residency match rates for emergency medicine. So I think I'm gonna go for it. If I get an acceptance, I'm going straight to a DO school.
Absolutely, man. Absolutely. Absolutely. Especially in EM. Like, and then you can do, if you want to do combat sports on the side, you'll be primed
Hey, high
for it.
pace. You'll be ready for that.
Ready.
You have probably inspired me to think more, broadly if I do want to
Yeah.
go into sports
You do the
medicine.
weekend, weekend fights. Like, go ahead,
Yeah.
bro. Like,
Right.
And like I wouldn't mind sitting like ringside watching my favorite fighters fight in front of me. So it would be
Yep.
pretty dope. Yeah. But we can move on to the segment four, Midi.
all right. So this segment is more about combat sports. This fun segment, we're gonna talk about combat sports. Talking about athletes in general, they operate under intense physical and mental pressure. What do you think physicians can learn from that aspect?
Honestly, at least I can speak on what I've already learned from fighters. These fighters are primed like no other human is primed, in my personal opinion. The discipline and the
Insane.
duration that they have,
Yeah,
it's on a different level. It really is. And if you have the opportunity to work with fighters, you'll be able to see that because it's not just the 10 minutes or 5 minutes of a fight, right? It's years and years of training,
yeah.
nutrition, sprint, and mental health. Like, and then don't even get me started on prep when you go into weight cutting.
Weight cut. Oh my
That's
Oh
God.
my God.
insane.
Yeah.
That's
Yeah.
we will do a podcast on that later, guys, once I'm a doctor,
It's a
okay?
whole conversation.
Yeah. So actually, I have a question on that too. So we're gonna go into it a little bit.
Yeah,
Yeah.
no, that's
Yeah. So, I mean, they're just primed like no other person is primed. And I think what physicians, medical students, honestly, anybody can take from that is that if you want something and you are willing to work hard enough to achieve it, you will get the thing that you're working to achieve.
I love
It
that.
is hard to achieve any goal, but I think that's what makes it worthwhile. You know, medical school is not easy. I've been fighting for my
Mhm.
life these past 4 years, okay? But I wouldn't trade it for the world. I absolutely adore what I do. I love medicine. I can't wait to be a physician, and I want to share that with everybody around me, right?
Mhm.
So I think the biggest thing that people can take from fighters is the discipline and the willpower that they have. If we incorporate even 1% of the discipline that a fighter has, I think we will be above the rest.
And I do think that fighters, again, you said discipline is one of the most important things. People think, oh, I'm motivated today, I won't be motivated tomorrow. Discipline is about like doing something you hate, but doing it like we love it. Who said that? Mike Tyson?
Yeah,
Mike
Mike
Tyson,
Tyson
there
did
we
say
go.
that. Yeah.
Go. But it's just about that aspect is sometimes you don't want to do something, but you have to do it. And I think fighters thrive in that aspect. They're always doing training is not easy. I did boxing for 6 years. It's one of the hardest things. I hated training.
Tell me about it.
So yeah. But also, I guess talk about weight cutting. We kind of dive into that a little bit. How bad is that for you? Because I've seen fighters drop 15 to 30 pounds
Which is
Yes.
in a
insane.
night, which is not healthy. Let's say that
Yes.
it's not healthy at all.
Yeah.
But we can talk
Well,
about it a little bit.
yeah. I don't know too much on weight cutting yet, as I'm not a doctor or anything, but
Mm,
from what I've seen, just personal experience, working fights, you know, a lot of people aren't weight cutting properly. It is something that is still in the community and I think is going to stay in combat sports for the foreseeable future. But I think my biggest concern, at least from what I've seen, was that they're not doing it right. The reason I say this, and I'm only speaking from personal experience, no medical advice here at all. I'm still a med student. But I remember there was this one fighter and got knocked out essentially, and he gets up and he's like screaming and he's like, I can't walk, like I can't walk. And so we run into the ring and we're like, do you need a stretcher, do you need a stretcher? And he's like, no, I don't need a stretcher, but I can't walk, like super agitated. And I was like, oh my god, like this was, mind you, this was my first fight ever, so I was like,
Oh,
Oh
what is
my God.
so we help him, my physician and I help him get out of the ring. And my physician actually leaves me with him. He's like, Misha, I want you to do like a neuro exam, do an MSK exam, kind of see what's going on. I have to go back to the ring so they can start the fights because a physician needs to be there for the fights to continue. So I was like, okay, I'll check on him and then you can come back and check on him later. So I'm there doing my whole exam, whatever. And then I asked him, I was like, how much do you weigh? He's like, I'm 125 pounds. I'm like, 125 pounds? No, how much do you normally weigh? He's like, oh, I'm normally 150. I'm like, how fast did you lose that weight? He's like, I lost all that weight in a week. Now,
Yeah.
again, no medical advice here, but I don't think that's healthy for you. And I don't think that's
Definitely not.
right. And so they go in there, they go into the ring dehydrated. They're already at a disadvantage. You are more likely to injure yourself there, right? Because you're not doing it properly, you're not maintaining your weight properly. So I think that's my biggest fear is more so of the not weight cutting in and of itself, but the improper weight cutting.
mhm. And also, amateur and pros weight cutting is different because in amateurs you get weighed, I think, the day of or a few
Mhm.
hours before, and pros obviously you get a day of
Yeah,
rehydration,
24
so
hours. Yeah.
you do get like that, kind of rehydrate. But that's why I think amateurs need to think about cutting weight is don't do it. Maybe do
Yeah.
it, but don't do it as like
Yeah.
10, 20
Some
pounds is
people,
too much.
yeah,
Yes.
some people try to
Yeah,
also, they call them weight bullies, in
yeah.
fighting, where some people try to cut way too much weight just so they have an advantage on the day or the fight or when they're actually fighting, but they try to rehydrate and then on the day of the fight they're maybe 20 pounds heavier than their opponent or something. But cutting that much weight in a fast speed and then getting it right back 24 hours later, it's so bad for you. And you
Yeah.
wouldn't be able to move the way you usually do if if your weight keeps fluctuating like that every single time. So
Exactly.
it,
So I'm actually starting some research. Hoping to get
Okay.
into some research on weight cutting soon. So maybe once I'm a physician, I can come back on as like an expert
second
one day.
And you
episode.
can talk about it. We would love that.
Yeah.
We would love
Oh, we
that.
would love that. Yes.
Yeah.
And then I
No.
guess talking about combat athletes, the injuries you see, a lot of head trauma, right? What's one thing athletes can do to kind of prevent, or not prevent, but maybe not see as frequent of injuries, especially to the head, that we see?
Yeah. Yeah. I think if you are fighting, head injury is going to be inevitable. You will
Yeah.
have some type of head injury. I think the best thing that you can really do for yourself, at least of what my own personal experience and what I've seen fighters do, and what I do myself as someone who does spar, who is training, just make sure you are listening to your body. If you are tired that day, don't go and push yourself to fight, especially if you're not a professional athlete. If you're not going there and you're not a UFC fighter, like take time to listen to yourself, because I promise you, when you push yourself to an extreme, I know hustle culture has made us believe that that's a good thing to do, but at the end of the day, your body is a temple that needs to be taken care of, and recovery is just as important as how hard you go at the gym. So make sure you listen to yourself and understand that maybe today I was going super hard, I was doing my sprint training, I did some sparring, but then the next day I'm gonna just go for a walk. I'm gonna take my dog for a walk. You know, that is okay. That is okay. And that is actually necessary to prevent injury, and to make sure that you are doing okay mentally. Because I know, as somebody who does box and who trains and who wants to fight one day, I know how
you want to compete.
I do.
Hey,
It's a goal of mine. It's a goal of mine.
amateurs, hey, amateur fights always the option.
None of Manib and I have trained, but we never thought of
I did one gym tournament like back in high school,
Yeah.
and it was hard because you get tournaments is different, right? You get multiple fights in one day. But talking about again, and in that process, I did get back-to-back concussions.
Yeah.
Yeah, in training, and it was a hustle mindset you're talking about. Where it's
yeah.
like I got a minor concussion, went back I think a week later, and I got another one because it's easier to get another one after you got one. And after that, the doctor told me, like, okay, you gotta stop.
Yeah, it's like this
And
is
that was my wake-up call because I really did feel like I was gonna die after that second one.
Yes.
It was a different, So I think after that, I was like, okay, maybe hustle culture. Hold on, I'm not that tough. I'm not invincible. Gotta
I
take
think
it
it would
easy.
still be cool, an amazing experience. You should step in the ring and
Oh yeah,
see.
100%. Like
it is a goal of mine.
lifetime experience.
Yeah, that's what I say. You know, my coach, he was telling me, he's like, yeah, we're gonna get you in, and I think it's because I know too much and I've seen too much being ringside and just being in medical school that I'm like very hesitant to do it. But I'm like, oh, I really want to do it.
One of our friends, he used to train Muay Thai. He used to compete in Muay Thai.
Oh.
Amateur fighter. He went 4-0, all knockouts. Amazing fighter. But he did it, and he said the reason he wanted to do it is because he used to be in the beginning. He was a skinny kid, and he used to be afraid of like getting in like troubles or anything, or just being involved in any sort of fight. But he wanted to overcome that fear, and that helped him with so much confidence. Because I feel like combat sports athletes, they're like you said, they have so much discipline, and their whole mindset is so insane.
The mindset changed completely once you
It's
start
a
training.
complete change of mindset. You become so confident. You can deal with anything. So he said whenever he stepped in the ring and he had a fight, it felt like it was just him versus this other person. And if he was the only person who could help him there. Nobody else was coming to save him. It was just him and the life in front of him. So that's why he did it. And since then, his whole mindset changed. And everything he just takes on is the hustle mindset thing where he's like, bring it on. I'll deal with it. It's okay.
The amount of confidence I've gained after training. So originally I started really in Muay Thai kickboxing, and then it wasn't until recently that I was like, all right, let me get my hands better. So I just have kind of switched to strict boxing. But yeah, I realized, I was like, oh gosh, like this is, especially when you're sparring somebody and they are coming for you with everything, and you're just like, I need to help myself. And I think that's like where a lot of my confidence grew too. It made me better. It's making me a better medical student. Will make me a better physician, and honestly, even a better content creator. Like everything has been positively affected by boxing. So that's why I'm like, maybe I will step in the ring.
I love to hear that. And I guess talking about a fight, you just watched the Ilya versus Justin fight?
Dude, I have it recorded. So I have it recorded. Yes, I have it recorded. I have to watch it. I have to go watch it.
Okay.
Don't tell me what happened.
Okay, I won't tell you what happened, but like, I did want to talk about it. Okay, it was this doctor that came in the ring.
Okay.
And it was doctor waved it off, but the ref let it go on. What do you think about that?
So doctor said he's not okay to fight this
fight.
person.
Yeah.
And the fighter was like, no, let me fight.
Because I've never seen that before, of doctor calling it off and ref overruling that.
Yes.
Referee did a horrible job, in my opinion. The referee should have stopped, because you always, like Manif said, you always listen to the doctor. And the doctor said no, and referee said no. The fighter is saying yes, so it's okay. Let him.
It's okay, yeah.
And it was a bad decision.
I've never seen that in combat sports. It was really just like.
So let me tell you guys, honestly, that is my biggest fear becoming a ringside medicine physician, because the only thing that I care about is my fighter. Like, that is the only thing that I care about. I want to make sure that they are okay. And again, with that, like, we were going back to what we were saying, that fighter mentality, the discipline and willpower that they have. I know if these people have a broken leg, like visibly broken
they'll keep
bone,
going.
they'll keep fighting.
Yeah.
So I'm like, I know almost to a certain extent, it's like my responsibility. But again, I've never heard of a ref overruling.
Yeah.
And that scares me. That really, really scares me, because I know a lot of referees have been fighters in the past, but at the end of the day, you're not a physician. So, the ringside medicine physician has training in ringside medicine, and they're doctors.
Exactly.
So I always think that the doctor should overrule, but that scares me. That's like my biggest fear, and that's one reason that sometimes sways me away from combat medicine. But then I'm like, oh, this is all I like to do, so I have to do it.
And I do think there was pressure from the White House card too, like a big card, a main card as well. But still, like I feel like a person's life is more important, or his career especially too. It could be a career-ending injury.
Yeah. That's the thing. And another thing too is, like, especially when it comes to any professional sport. Let's just take combat sports aside. Any professional sport, like you see Lindsey Vonn, right? So she already had a torn ACL. She did that jump, almost died. Right? Professional athletes, another thing that I think we as future physicians need to take into account is that this is not just their health. For us, their health is number one. For them, this is their career. So they're on that fine line of balancing career and health. And a lot of the times, at least from what I see from pro athletes, is that career trumps the health. They're like, I can do it. I'm invincible. Like I'm fine. And then they go do something that could potentially be deadly. And that's a really big fear that I have. But at the end of the day, you have to understand that every athlete, they are capable of making their own decisions. We are there to guide them. As future physicians, we will be there to guide them, give them the tools that they need, make sure that they understand what they're doing. But everyone has their own autonomy, right? That's what we learned in med school. So we have to be okay with it, but it's hard. It's really hard to be okay.
I agree 100%. And then we can move on to the last segment.
Yeah. Wonderful. Now, this segment is more for advice for the students, especially like the Dreamers podcast viewers. My first question is for students listening who may have career goals that seem unconventional or different from the norm and what everybody else around them is doing. What advice would you give them?
I would say that my biggest piece of advice is listen to your gut. I think a lot of the times there's so much noise around us, and there's so many people out there telling us what to do, what is right, what is not. It's very hard to distinguish what our own thoughts are versus the thoughts of other people. If you have unconventional goals, or if you have goals that are very difficult, that your goals are your goals and you are listening to what you want to do, because I promise you it is very easy to get swept up into I should do this because X, Y, and Z is doing that, or I need to do this because so and so said I need to do this. I've done it before. I am not holier than thou. I have lost my way many, many times, but then I've always come back to who I was as a person and understood that my goals and my dreams are my goals and my dreams for a reason. So I think that's my biggest piece of advice, is just listen to your gut. You know what you want to do. It's just, will you listen to yourself, I think, is the big question here.
I love that. Amazing advice.
I would ask my advice question as well, but I'm pretty sure you just answered it as well. You answered both, so I'm going to go ahead and skip it.
All right. Well, Misha, I think we're at the end of the podcast. I wanted to hear your opinion first. What did you think about the podcast? How was the experience being up here with us?
Oh my God, I loved it. Thank you guys so much. It was so much fun. I love doing podcasts, and I love talking about everything combat medicine, sports medicine. So it was so much fun.
Also, it was special for us because we're big fans of combat sports.
Yeah.
Agreed. Yeah, big fight fans. That's why as soon as I came across your page, I was like, okay, this is a guest that I would love to bring on and get her opinions on it. And hopefully in the future, we would love to do in-person
yeah.
with you. Maybe we can talk more about whenever at that time you will get your research done on the weight cutting
and everything.
That'd
be a big research.
Yes.
I want to see that. Yeah.
I love that. So thank you so much for joining us today, Misha. We really appreciated you talking about your journey and just sharing your experiences with us. I am pretty sure a lot of our students would be able to relate to your journey and would get inspired by it.
Thank you
And
guys
to
so
our and to our dreamers listening, remember your future career does not have to look anything like someone else's. Someone's meaningful journey begin when you're willing to pursue a path that few others can see. And again, we'll see you guys next time on the Dreamers Podcast.
Like, subscribe, share, please. Thank you.
All right,
All right,
we're
we can
done.
finish the recording.